Yeah, Mr. President, the Supreme Court is about to rule on King versus Burwell. And in this decision, it is a question of whether or not a plain reading of the law, which is that subsidies shall only be given to those who reside in states which have established state exchanges, is the plain reading of the law. The administration maintains no, that states doesn't mean states, but rather that it can be an exchange set up by either the state or by the federal government. Now, presuming that the federal government, that the Supreme Court decides that no, a plain reading of the law is correct, that for a resident of a state to receive a subsidy, then they have to reside in a state in which a state establishes an exchange. There are 37 states in which those currently receiving subsidies shall lose their subsidy. Now, this is important because under Obamacare, we've seen a dramatic increase in the cost of health insurance premiums. So many people who formerly would have been able to afford an insurance premium no longer can without the subsidy. What this means for that person in my state like Louisiana is there'll be someone in the middle of chemotherapy who can no longer afford her insurance without a subsidy because the insurance has been made so high because of Obamacare. She can no longer afford her insurance, and she is at risk of losing her coverage because the administration illegally implemented the law. Now, this is where we are going into the Supreme Court decision. Let me kind of now start on a different tack. The President's health care law, Obamacare, the Affordable Care Act, has continued to be singularly unpopular. A recent ABC poll showed that only 39% of Americans approved of the law. That is an all-time low, 10% lower than it has been. You can ask, why would it be unpopular, and why would it be particularly unpopular now? I think the reason it is unpopular in general is that the Obamacare is a coercive federal government program that if you don't bend your will to the federal government will penalize you. Now, that is not how Americans view their relationship to the federal government. We don't expect the government to tell us what to do. There might be income taxes, which we pay, and there will be draft in times of wars such as World War II. In general, aside from those two things, the federal government should just stay out of our lives. And in this case, in Obamacare, the federal government gets right in the middle of that which is most personal, and that is our health care. And I think the reason that Obamacare is particularly unpopular now is because of the premium increases that have resulted because of Obamacare. Here's some headlines. CNN, Obamacare sticker shock. Big rate hikes proposed for 2016. AP, many health insurers go big with their initial 2016 rate increases. Again, AP, 8 Minnesota health plans propose big premium increases for 2016. New York Times, in Vermont, frustrations mount over Affordable Care Act. The Washington Post, almost half of Obamacare exchanges face financial struggles in the future. In my own state, insurers are asking for 20% increases, and this is on top of premium increases that have resulted from the previous few years. Indeed, the President likes to speak about how health care costs under Obamacare have mitigated. Health care cost. Actually, that began in 2007, before Obamacare passed. But since Obamacare passed, it's been true. Health care costs have not risen as they did in the past. Health insurance costs have gone up dramatically. The remarkable story of Obamacare is there's now no relationship between health insurance cost and health care cost. The insurance companies, with the regulations imposed by Obamacare, are charging far more for insurance than you would expect because of the health care cost. Of course, the President chooses to speak of the cost of care, not the cost of premiums, but for the average person, it is a cost of premiums which is making her so frustrated with this law. Now, that brings us back to King versus Burwell. At this point, I am offering today, along with several original co-sponsors, what we call the Patient Freedom Act. We give patients the power, which Obamacare took from them, and we give them the power by lowering the cost. We lower the cost by eliminating the mandates that are part of Obamacare. We return power to the states over insurance with the rationale that she who governs best governs closest to those who are governed. The insurance commissioner in that state should be able to decide what the person in their state wishes to have for their policy, not a Washington bureaucrat. And we give patients knowledge. We give them price transparency. They should know the cost of something that is ordered for them before they have the procedure performed, as opposed to learning afterwards. We give them portability. We give them protection against pre-existing conditions. And I will say, I and others, I think you, Mr. President, have campaigned for several cycles that we were going to repeal and replace Obamacare. In this situation, the Supreme Court will repeal a portion of Obamacare. Not all, but a portion, in 37 states. And this is the plan that will replace that which Obamacare repeals. And we like to look at it this way. We begin to plant the seeds. Now, in those 37 states, those 8 million people affected by the Obama administration's illegal implementation of the subsidy law, we make it better for them. And plant the seeds so that over time, other aspects and eventually the entirety of Obamacare will be replaced with something which gives the patient the power as opposed to a Washington bureaucrat. So let me lay out what we do. King versus Burwell goes against the administration. The Supreme Court rules the law has been implemented illegally. States then have a choice. They can either establish a state exchange if they wish for the status quo of Obamacare. The state can do nothing, which means that in that state, all of Obamacare goes away for the private insurance market, or they can choose the Patient Freedom Act, which is the market-based reform that we think gives the patient the power, not the bureaucrat. Next. Now let me compare the two. I mentioned how under the Patient Freedom Act, costs are lowered by repealing mandates. For example, under Obamacare, there is an individual mandate with a penalty, a coercive penalty. The Patient Freedom Act does not have that. There's an employer mandate penalty. Yes, under Obamacare, the employer is penalized. In the Patient Freedom Act, no. The federal essential health benefits mandates. Under Obamacare, a Washington bureaucrat tells somebody that which they must purchase. In the Patient Freedom Act, we return that to the state insurance commissioner. We do not have these mandates. And I can go down, but the reality is that Obamacare, coercive mandates, the Patient Freedom Act, no. And the money that we make available to the states, we take from the tax credits that Obamacare would give to those in the state if those who are eligible signed up. We take the Medicaid funding that would be available if the state did the Medicaid expansion. We combine those two for the total allocation that will go to that state. Now, some would say, wait a second, the federal government should not be in the business of helping people with health insurance. I'll say the federal government's deeply in that business already. If you look under public insurance, there's Medicare, Medicaid, CHIP, VA, TRICARE, on, where the federal government is providing health care benefits for a substantial portion, over 25% of Americans. These are those Americans that get their insurance through the employer-sponsored insurance, where the employer and the employee can contribute to their insurance, but they get a tax break on the purchase, and that tax break averages about $1,700. We are speaking about that remaining group that purchases their insurance for themselves, and we lower their costs by equalizing the tax treatment between the two. The same sort of tax break that those with employer-sponsored insurance receive, we will now offer that same tax break to these folks, and in so doing, achieve that conservative goal of equalizing the tax treatment of those purchased from employer-sponsored insurance as opposed to purchasing on their own. Next. Now, the funding goes to the patient. I'm a doctor. I've been working in a public hospital system for 25 years, and I learned working as a physician in both the private setting, but principally the public hospital setting, that whoever controls the dollar has the power. Now, if it's a bureaucrat that that controls that dollar, then the bureaucrat will dictate the type of the facility the patient is seen in. If the patient controls the dollar, the hospitals are going to compete for her business, and she dictates the type of facility in which she is seen. So in the Patient Freedom Act, the money goes directly to the patient. It can go through the state. The money can be granted to the state on a per-patient enrolled grant type, and in so doing, the state would then distribute, and there are advantages for the state to do the distribution. Or if the state does not want that responsibility, it can be a federal tax credit that goes into a health savings account that the patient controls. But either way, the patient controls the dollar. The patient has the power, not a bureaucrat. Next slide. And here's a brief how it'll work. Here's the health savings deposit that goes into a health savings account. There'll be some reforms in the bill that allow the patient to either use it as her contribution, as the employee's contribution on an employer-sponsored plan. She can directly contract with a provider network. She can purchase commercial insurance. Or if she does nothing, the state has the option of creating a system in where someone is enrolled unless they choose not to be. Again, I'm going to call upon my experience as a physician. Think of a person who might be schizophrenic, homeless, living beneath a bridge. He is never going to do what Obamacare mandates, which is to get on the internet and fill out a 16-page form. Just not going to happen. I've been there, I've done that, I've been in the ER in the middle of the night when the patient has come in with some acute medical or trauma condition. Under this system, though, the state could have this person enrolled unless they choose not to be. And so with the health savings account, they would have first dollar coverage for a visit should they decide to go into an outpatient clinic for a foot that was infected. If they have some major issue and they're brought to the hospital, the catastrophic policy would then give them the coverage for that hospitalization, but also protect the hospital, the doctors, and other providers from taking a total loss, which, by the way, society ends up paying for because they have no coverage for that hospitalization. So with this system, we can achieve higher enrollments than are achieved under Obamacare. And lastly, let me talk about one more way in which we think patients will have the power. One, they'll have the power of portability. Every year in an open enrollment system season, if the patient wishes to change plans, she may without penalty. Secondly, she will be protected against pre-existing conditions. The only rating that will be required for premiums will be for geography and age. At work, she can purchase commercial insurance, or if she does nothing, the state has the option of creating a system in where someone is enrolled unless they choose not to be. Again, I'm going to call upon my experience as a physician. Think of a person who might be schizophrenic, homeless, living beneath a bridge. He is never going to do what Obamacare mandates, which is to get on the internet and fill out a 16-page form. Just not going to happen. I've been there, I've done that, I've been in the ER in the middle of the night when the patient has come in with some acute medical or trauma condition. Under this system, though, the state could have this person enrolled unless they choose not to be. And so with the health savings account, they would have first dollar coverage for a visit should they decide to go into an outpatient clinic for a foot that was infected. If they have some major issue and they're brought to the hospital, the catastrophic policy would then give them the coverage for that hospitalization, but also protect the hospital, the doctors, and other providers from taking a total loss, which, by the way, society ends up paying for because they have no coverage for that hospitalization. So with this system, we can achieve higher enrollments than are achieved under Obamacare. And lastly, let me talk about one more way in which we think patients will have the power. One, they'll have the power of portability. Every year in an open enrollment system season, if the patient wishes to change plans, she may without penalty. Secondly, she will be protected against pre-existing conditions. The only rating that will be required for premiums will be for geography and age. A 57-year-old will get a bigger credit than a 20-year-old, but aside from age and again, geographic, because it's more expensive to receive health care in Manhattan, New York than Manhattan, Kansas, then that would be the only differences allowed. And lastly, there'll be the power of price transparency. Currently, a woman goes in with her daughter, the doctor orders a CT scan, and the patient has no clue what the cost of that CT scan is. Now, it can be anywhere from $250 to $2,500 or more. I picked those numbers because the LA Times had an article a couple years ago. They found that the difference in cash price for CT scans was $250 to $2,500. The only way someone could know is if they were an investigative reporter and able to find out, not if you're a mom with a sick child who needed a CT scan. For me, it's going to be great when the mother can take her smartphone, scan a QR code, and pull up something which says, CT scan $250 here, $2,500 there. I'm going to make my decision based on some combination of cost, quality, and convenience. I will pick, based upon my values, where to go. It's not a Washington bureaucrat. It is a mother who's going to make that decision. So again, continuous coverage protects those with pre-existing conditions, and we mentioned the price transparency. In this way, Republicans will give states the option to choose. Again, they can stay in Obamacare if they want. They have that option now. They can do nothing and it goes away because the Supreme Court, if the Supreme Court rules that the subsidies have been implemented illegally, or they can go with the Patient Freedom Act. The Patient Freedom Act, which gives patients the power by lowering the cost by eliminating mandates, returning power over insurance back to the commissioners who govern closest to those who actually will be using the insurance, and then giving the patient the power of portability, protection against pre-existing conditions, and the power of price transparency. Mr. President.
The senator from Maine.
Thank you, Mr. President. Mr. President, let me begin my remarks this evening by commending my friend and colleague, the senator from Louisiana, for coming up with a creative and comprehensive health care bill that I am pleased to co-sponsor. As a physician, Senator Cassidy knows far better than most of us in this body what it is like to deliver health care and has made a real effort to come up with a public policy response in anticipation of the Supreme Court's decision in King versus Burwell, which is expected to be handed down later this month. So I thank him for his work and his creativity in tackling a very complex issue. Mr. President, as I mentioned, later this month, the court is expected to rule in King versus Burwell, a case challenging the availability of premium tax credits under the Affordable Care Act in the 37 states that have not established a state-run health insurance exchange. If the Supreme Court rules in favor of the plaintiffs, as many experts expect that it will, 6.4 million Americans who are now receiving premium tax credits through the federally run exchanges will lose their subsidies, and as a result, their health insurance may well become unaffordable. This includes almost 61,000 people in my state of Maine. Such a decision, Mr. President, will place responsibility on Congress and the President to work together to protect those individuals. Senator Cassidy and I believe that we can do this by extending the current subsidies for a transition period as contemplated by the sense of Congress language included in the Patient Freedom Act that we are introducing today. But the Supreme Court's decision will also invite us to think anew about how to ensure that all Americans have access to affordable, high-quality health care. We can advance this goal by revamping and reforming the Affordable Care Act to improve the quality and affordability of health care while retaining the insurance market reforms that are so important to consumers. Senator Cassidy's Patient Freedom Act is precisely the type of new thinking that we need. As the title of this bill suggests, the Patient Freedom Act is built on the premise that freeing people to take charge of their health care is superior to the one-size-fits-all approach of Obamacare. A decision for the plaintiffs in King versus Burwell would essentially leave states with two options absent congressional action. They could either set up a state-run exchange to ensure that their residents have access to the Affordable Care Act subsidies, or do nothing and allow their residents to lose these Obamacare subsidies. Under Senator Cassidy's bill, however, states with federally run exchanges would have a third option. They would have the choice of participating in the new Patient Freedom Act. Participating in the Patient Freedom Act would allow states to structure their health insurance market without an individual mandate or an employer mandate or many of the other expensive mandates under Obamacare. In return, states would have to offer their citizens a basic health insurance plan that would include first dollar coverage through a health savings account, basic prescription drug coverage, a high deductible health plan to protect enrollees against medical bankruptcy, coverage for pre-existing conditions, that's a good provision of the current law that we would retain, coverage through a parent's plan for children up to age 26, another good provision of the law that we would retain, and there could be no annual or lifetime limits on insurance claims. Again, a good provision of the current law that we would retain. Here's how it would work. The federal government would provide funding directly into the health savings accounts of individuals insured through the Patient Freedom Act. These funds would be phased out for higher income individuals. The aggregate funding for these per patient per capita grants would be determined based on the total amount of funding that the federal government would have provided in the form of Obamacare subsidies in each state, plus any funding each state would have received had they chosen to expand their Medicaid program, even if, like the state of Maine, they had chosen not to do so. In addition to federal funds, individuals and employers could make tax-advantaged contributions to these health savings accounts. The bill even provides for a partial tax credit for very low-income individuals who do receive employer-based coverage, but it would help these workers pay for their deductibles and co-pays. Individuals who are insured under the Patient Freedom Act would receive debit cards tied to their health savings accounts, which they could use to purchase a high deductible health plan, to pay directly for medical expenses or pay premiums for a more generous health insurance policy. In addition, healthcare providers receiving payment from the health savings accounts would be required to publish cash prices for their services, which would add transparency that we desperately need to move toward a more patient-directed healthcare future. The promise of patient-directed healthcare is one of the advantages of this approach, but it has other advantages as well. For example, residents of states that elect this option would no longer face the individual mandate, a penalty that can cost individuals 2.5% of their income, and the typical American family of four an estimated $2,100 next year. It would also codify the elimination of the employer mandate in these states, freeing these employers to add jobs and let their full-time employees work 40 hours a week. Obamacare has been causing some employers to reduce hours for their employees. The result has been smaller paychecks for those workers. Perhaps most important, however, the Patient Freedom Act would do away with what the Superintendent of Insurance in Maine refers to as wage lock. That is caused by the fact that the subsidies in the Obamacare exchanges phase out completely at 400% of the federal poverty level. In other words, there's a cliff there. Now, 400% of the poverty level is just over $47,000 for an individual and about $64,000 for a couple. Taxpayers who earn just $1 more than that threshold lose their entire subsidy. That makes no sense whatsoever. It's one of the major flaws in Obamacare. Since these subsidies are based upon estimated earnings that are later reconciled through tax returns, Americans are facing onerous tax liabilities and penalties as a consequence. Now, let me explain further how this wage lock occurs, because increasingly Americans are going to be running into this problem. Let me give you an example. Last year, the least expensive premium for a silver plan to cover a 50-year-old individual in Aroostook County, Maine, cost $6,300 through an Affordable Care Act exchange. But that obviously is not what most individuals pay. Instead, they receive a subsidy that phases out based on their estimated income. But again, the subsidy completely disappears at a sharp clip at 400% of the federal poverty level. An individual whose estimated income is just less than this cliff, say one that is earning $46,500, will pay 9.5% of his or her income, or $4,370 for insurance, and the rest is covered by the federal tax credits. But if it turns out that this individual actually made a bit more than 400% of the federal poverty level, let's say the individual made $47,000, then he or she would be on the hook for the entire $6,300 premium. In other words, a 50-year-old who makes just $500 more than he or she estimated will have to pay $2,000 more at tax time for health insurance in the exchange. Now think about what this means for a self-employed individual whose income fluctuates not only from year to year, but from month to month. This is a financial nightmare to try to figure out. This cliff doesn't just affect individuals who get their coverage through the ACA. Cliffs appear over and over again in the design of the subsidies under Obamacare. And couples and families will face them at different levels of income as their household size changes. What will these bait and switch health insurance premiums do to incentives to work harder, to earn more, to accept promotions? If you accept a promotion at work and then your income goes over that magic 400% of poverty threshold, you're gonna lose your entire subsidy. So you might well decide to turn down that raise at work or that opportunity to be promoted to a better job. What kind of system has been designed to discourage people from moving ahead in the workplace? Now, Mr. President, in the state of Maine so far, we have learned that at least 1,000 Maine families have lost their subsidies completely because they were in that situation where their income went over that threshold. Another 1,000 Mainers are finding out that they're losing part of their subsidy and are going to be on the hook for paying more money. And I will say to my colleagues that you're going to start hearing this in your states, and it particularly is going to affect people who are self-employed and who have to estimate what their income is going to be. And through no fault of their own, unless they're going to turn down work, they may well go over the threshold amount, lose their subsidy altogether. Remember, it takes just $1 in additional earnings at the 400% of poverty level to lose your subsidy altogether. Let me give you an example of a Maine couple who contacted my office. They discovered to their horror when they filed their taxes that they had earned more than the threshold and that they owed $13,000 to the IRS for the health insurance they received through the Obamacare exchange, on top of the $4,000 that they had been told that their exchange coverage would cost. Imagine finding out that because you worked a little harder, because you earned a bit more money, that you now unexpectedly owe an extra $13,000 to the IRS because you've lost your subsidy. The Patient Freedom Act would put an end to the bait and switch premiums that are built in to the Obamacare exchanges. Mr. President, one of the reasons that I opposed the Affordable Care Act was there was nothing affordable about it. I predicted at the time that it would lead to fewer choices and higher insurance costs for many middle-income Americans and small businesses. A ruling in favor of the plaintiffs in King versus Burwell would prompt Congress to protect those who would lose their subsidies, but it would also provide the opportunity to give states the option to replace the Affordable Care Act's poorly crafted mandates with patient-directed reforms that contain costs, provide more choices, and still provide assistance to those who need it most. The Patient Freedom Act does exactly that, and I urge my colleagues to support it. Thank you, Mr. President. Mr. President, I now ask unanimous consent that the Senate be in a period of morning business with senators permitted to speak therein for up to 10 minutes each.
Without objection.
Thank you, Mr. President.
Mr. President,
Senator from Louisiana.
can I briefly say I thank Senator Collins for her thoughtful review of the Patient Freedom Act, who after our office, she has probably reviewed it the most and made several substantive changes which have made it better. And I also thank her for her speech just then, which was again a very thoughtful critique of why we're replacing Obamacare, not because it's the president's bill, but because of things that she described where people have an incentive not to earn more money and a penalty if they do, which goes against the American values that if you work hard, you can be more successful. It shouldn't be the federal government discouraging that. So I thank her for both her thoughtful speech, her thoughtful comments, and her great input into the final product. Thank you.